Appreciate you being here today as we discuss important developments taking place relating to Cover Oregon. This morning, our congressional representative, Greg Walden, announced that a federal GAO audit will be requested to determine the appropriateness of the money that has been allocated and how it's been spent on the Cover Oregon project. It's important that we have this federal GAO audit because we need an independent review of this entire program. We're not going to have that here in Oregon. As you will recall, in recent months, the governor has said that he knew nothing about the difficulties and deficiencies with this project until October of last year, which was after the launch date. The media has looked into this, has done excellent research, and has determined that that was not the case. I was finally contacted about my involvement with Cover Oregon and whether or not the governor knew about the problems that it was facing early on. And I reminded them that I was co-chair of Ways and Means in the 2011 session, and I held up the acceptance of the federal grant of $48 million as an early adopter of an Oregon Health Exchange project for several weeks because it was apparent to me that the state has not been able to handle huge projects on IT issues in an effective and efficient and economical manner. Ultimately, the grant request was approved after the Oregon Health Authority and the Oregon Health Exchange, which later was renamed Cover Oregon, promised that this project would be dealt with and handled and promoted as if it were a $100 million private startup. They promised that they would hire a quality assurance team as an outside group to oversee the project and ensure that it was going to be conducted in a timely and responsible manner. Ultimately, the quality assurance team was hired, and that was Maximus. And the reason that there's this discussion about Cover Oregon today is because there was a QA on this project. In the past, when we've had state projects that have failed, the information around those failures has been just kind of swept under the rug, and all we know is that another project has gone down and hundreds of millions of dollars has been wasted. Cover Oregon is different because we had an independent team that have been giving reports on a monthly basis indicating that this project was not going to start on time, that it was not going to accomplish the goals that it was set out to do, that it did not have the quality and level of experience needed to make it work. And this was known since the month after Maximus was hired, which is roughly 2 years before the October date. So what does that really mean? It means that the authorities at the Oregon Health Authority and Cover Oregon and the governor all knew that this project was not going to launch on October 1st. And yet we went forward anyway, making promises that it was going to be, that it was going to work, that Oregon was being looked to by the nation as kind of an early adopter, a role model for other states to use. It's like turning on a light switch knowing that there's no wiring in the wall. But nevertheless, they went forward with this launch, and then the governor has indicated he knew nothing about the problems. We now know that the governor has spent or contracted for $228,000 to hire another team to come in and determine what went wrong with Cover Oregon. We spent over $1 million for Maximus's QA team, and they've given us detailed information as to why it wasn't going to work and why it hasn't worked. We do not need a new contract hired by the governor when the terms of the contract indicate that their findings do not need to be disclosed to the general public. Since you can't get disclosure, since you can't trust what we're being told by the leadership, it's important that we have a federal GAO audit to come in and determine what took place, why we've spent over $160 million already and have nothing to show for it, and whether it's appropriate to continue to spend federal grant money up to $304 million that's been approved on a project that's a failure, that is duplicative of the work that's been done in the federal exchange and in other states. So it's unnecessary for us to continue, and then also to have a project which is going to be unsustainable in the future. In closing, let me just mention that Cover Oregon is not going to be self-sufficient in the future. We were told from the beginning that if there was ever a time that Cover Oregon was not going to be able to pay for itself when the federal money ended, that it would be shut down. And now we've been told by the acting director of Cover Oregon that it's not going to be self-sufficient next year, and there's no indication it's going to be shut down, which means it's going to take precious funds away from the senior programs, from education, from public safety, and other areas where that money is desperately needed, high priorities, merely to keep afloat a failed ship. This ship has never floated, and it's not going to float, and it's not going to be able to accomplish the goals that it was set out to do. So with that, we'd be open for any questions that you might have.
You, pardon my voice today, it's kind of got a frog in it, but you talk about the director, I assume you're talking about Bruce Goldberg, telling you that it's not going to be self-sufficient next year. Yesterday he laid out his budget and made it look like it would be. So where's the, where did you get that it's not going to be self-sufficient?
Recently, Director Goldberg indicated that for it to be self-sufficient, there needed to be 145,000 individual policies issued, and that the budget needed to be reduced by 20%. We currently have about 34,000 policies that have actually been issued. There is no way that we reasonably can expect that that is going to go by over 100,000 more in the time frame that we have. And so if you can't lower your budget by 20% and you can't get 100,000 more people to sign up, there's not going to be the money to do it. They need to admit it and not continue this series of misrepresentations and false hope that it does not meet a rational test.
And who would have access to the results or the findings of the audit that the governor has ordered? You said it's not going to be disclosed to the public, so who will be privy to that?
The governor.
Just the governor.
The governor and whoever he would indicate should receive those findings, but the public will not be assured that good or bad, positive or negative, those findings would be disclosed. We have an amendment to a bill that's being considered by the legislature now that would require full disclosure of the results of that audit that the governor has requested. And we are being told that that amendment is not going to be allowed to go through.
The governor has said that he will release it to the public. Do you just not believe him?
I have no reason to disbelieve him other than the fact that things have been misrepresented in the past. But I believe that it's appropriate that we would have an outside entity be contracted to do it, and the GAO is known across the country as being a no-nonsense, fair, rational auditing agency. It's federal money that's on the line, hundreds of millions of dollars of taxpayer dollars that are on the line, and so we really do need to have a federal audit take place.
If they agree to do the investigation, what's the timeline on that? In other words, when will you find out they say, yes, we're looking into this, and when they do look into it, how long does that process typically take? When will we get answers?
Congressman Walden said that this is a high priority, that when the Congress requests that this take place, that it will get immediate attention, but he was unable to disclose what the time frame would be other than they know that this is very time sensitive. So we do not have a date. We can't answer for them yet.
What about folks who think that what you're doing now is basically kind of a grandstanding effort for your campaign against the eventual potential campaign against the governor for the governorship?
What's important to know is one of the reasons I'm running for governor is because I cannot tolerate a continual series of misrepresentations, of false promises, and lack of leadership. That's why I'm running for governor. Realize that this whole thing centered on what took place in 2011 and 2011 and 2012 when I was the co-chair of Ways and Means. It was because of my position as co-chair that we had Maximus, and that I made the request of the governor and the Cover Oregon and Oregon Health Authority leaders that they come forward and fix the problems. When I talked to the governor, when I sent out the emails to him and to his leaders back in September of 2012, it was 13 months before the launch date. There were 13 months to make the corrections, to send out the cure letters to Oracle, which normally would happen in a private project. If you see that there's problems, you got your contractors like Oracle, you would send out a cure letter saying that you have 30 to 60 days, whatever it is, to fix these problems. No cure letters were sent. Oracle continued to receive what has now been billed at roughly $100 million in contract fees. Their contract was on time and materials, not on outcome. The whole thing has been botched from the beginning. The very thing that I feared would take place back in 2011 when I withheld the approval for the grant money is exactly what has occurred.
So is your criticism of Cover Oregon political or personal?
It's neither. It's professional. I've been elected by the people to represent the people. I feel that the money that we have in this state is a stewardship, and that we as elected officials have a responsibility to treat it as if it were our own money. That's what I actually told the governor. I said if it was your money, your $48 million that was on the line, you wouldn't say just trust the team when you had hired a quality assurance group to come in and oversee the project, and they're telling you that this is a train wreck that's about to happen. I mean, if you know a train wreck is coming, you don't stay in the club car and toast each other.
The governor argues that 103,000 people are enrolled. Does that mean that it's basically working even on the technical side of it? Some stuff is not?
No, it's merely using the statistics in a way that makes it look like it's something that it's not. Cover Oregon was designed to enroll individuals for private health policies. They've enrolled about 34,000 people. All of the additional policies that they've done, all the additional insureds have gone to Medicaid. And Oregon Health Authority also is signing people up for Medicaid. Cover Oregon did not need to do that. They could have referred those people to OHA and focused on their mission, which was to sign up and enroll individuals for individual health insurance policies.
I got one more. KGW, we talked to Governor Kitzhaber yesterday, and I'm going to quote him about the GAO investigation. He said, the federal government is going to do what it's going to do, and as long as it doesn't interfere with enrolling Oregonians in health care coverage, we'll wait and see. What do you make of that?
I think he's absolutely right, and that there's no question. The GAO is not going to interfere with enrolling individuals for health care. They want to see what has happened with the money. Is there fraud? Is there waste? Is there abuse? Were there criminal activities, which there are allegations that there may be? And they will be watching out for the taxpayers' money because it's all our money. Whether it's federal money or state money, it's all the money of the citizens.
So what are the chances of this actually happening? You say you're making the request, so what kind of things have you heard and as the amount of support around it?
Congressman Walden has made preliminary contacts with the GAO and feels quite certain that the request will be granted.
Should the site be scrapped?
The legislature right now is considering that option. I personally believe that it should be shut down so that we don't continue to throw good money after bad. Right now, we have other sites that are enrolling people into individual health policies. So why are we continuing to spend millions more to try and do that which is going to duplicate what's already being done by other states and the federal government? And then you add to it the reality that it's not sustainable in the future without being supplemented from general funds of the state. There is no good reason to continue a failed program such as Cover Oregon.
Has any good come out of Cover Oregon, in your opinion?
Oh, absolutely. I mean, the number of number 2 pencils that have been sold in Oregon has gone up dramatically. I mean, we're filling out these forms individually, just like we did 50 years ago, and so it's kind of like hearkening back to the way we used to do things. I mean, that's good, I guess. And there are a number of people who have coverage. I'm not saying that's been a total failure. It's just that the website's been a total failure, and we are signing people up for the federally adopted Affordable Care Act and our equivalent of that. And so for those that have health coverage, that's a good thing. For those that have been left uncertain and without coverage, it didn't have to happen. Realize there were 145,000 Oregonians that got cancellation notices, and there's still thousands that are uncertain about their health care. Now, one of the reasons that we have the GAO audit is that we have presented over 5,000 Oregonians who have joined in this request for the GAO to conduct an independent federal audit of Cover Oregon. These 5,000 Oregonians need to be listened to, and they merely are a representative of tens of thousands of Oregonians across the state who want answers to what happened to the $160 million plus that's already been spent, and what are we doing now? These answers are not forthcoming without a federal audit.
Federal audit's going to cost money. How much money? Isn't that throwing bad money after, or good money after bad?
The federal audit is, the GAO has an assigned staff, and they select which projects they're going to audit. And they don't hire people for each individual audit. Their goal, their job is to ensure that the taxpayers' money is well spent. And you're going to have to spend money on audits occasionally to determine where things are at and whether or not the law has been kept or the law has been broken. And so this is one of the audits. We're hoping that it will get a priority position, but it's not going to cost additional money. There'll be some, but we're talking about hundreds of millions of dollars at stake. And so the money that they spend doing this audit will be money well spent.
Aside from the two individuals who have stepped aside from Cover Oregon so far, do you think anybody else should resign at this point?
It's really not for me to determine the level of competency of those that were involved in this project, and so I would not care to comment on that.
Do you have a contingency plan if hypothetically Cover Oregon were to get scrapped next month?
Well, if it were to be scrapped, basically what you would continue to do is sign people up as we are currently and stop throwing money to develop the software when the software is already being used elsewhere. And so there really would not need to be a contingency plan at this point, 4 months after the launch date, other than to transition so that in the future we can utilize the resources of online, for signing people up online, and realize that we have problems coming. We have the STOP program. You have small businesses that are supposed to be signed up. They're on a delay, but that's coming. And the medical providers are supposed to be able to submit their bills through Cover Oregon. And so you have hospitals that are not getting paid, or where payments are delayed because they're having to use alternative methods when they were supposed to be able to bill through Cover Oregon and save money and administration costs that way. Thank you very much for being here. Appreciate your interest in this. We will keep you updated on the results with the request for the GAO audit.